Thank you, Dr. Zainab. Now we're going to be with Dr. Fayza Haider. She is the first and up to date, the only female consultant pediatric surgeon in the Kingdom of Bahrain. She works in the largest tertiary care and teaching hospital in the Kingdom. She trained at the Children's Hospital of Eastern Ontario in Ottawa, Ontario, Canada, where she completed her pediatric general surgery clinical fellowship. Dr. Haider is board certified in general surgery from the Arab Board of Health Specialization. She holds a membership of the Royal College of Surgeons of Ireland, Arabian Gulf University, College of Medicine and Medical Sciences, and her undergraduate university, where she obtained her medical doctor degree and Bachelor of Basic Medical Sciences. Dr. Haider is a clinical tutor at her undergraduate university and a training coordinator of the department. She is well known for her educational activities, organization, and CPD accreditation. She is the editor of the annual report of Department of Surgery at her institute. So, welcome, Dr. Faiza Haider.
Thank you very much for this introduction. Can I get the privilege to share the screen, please?
Yes, doctor. Absolutely.
So until I get the privilege, I would like to thank the organizing committee for requesting my participation in this very well organized conference. And I would like to thank especially Dr. Aisha, who pulled me into this. She is a doctor eventually, I know. Thank you, Hassan, also, and for all of the organizing committee.
My pleasure.
So will I be able?
Yes.
Okay, I'm able to share. So thank you for all the presenters. My presentation is very short and concise. And I hope my internet is clear and my voice because I'm airing from my office at Salmania. Okay, let's see if we can. Yeah. Okay, is my presentation seen? Okay, thank you. So I did title my presentation as Want to Become a Surgeon. Please follow closely. It is not easy to become a surgeon, but always follow your passion for anything that you want. So how will I approach this presentation? It's short and concise, don't worry. I'm not taking a long time. I don't like to crowd my slides, and I think that's well known by me. I'll give an introduction and the surgical education levels, which a lot of people have alluded to. A typical week of a surgeon in training, my surgical career, which I really don't like talking about a lot. And then what next? Once you're a consultant, what are you going to do? And is this the end? Of course not. So surgery as a specialty is a huge challenge. Okay, people keep on unmuting themselves, but that's fine. Surgery as a specialty is a huge challenge in both education and training. The last 50 years have seen huge growth worldwide in the provision of education and training at all levels of medical specialties. So how old is surgery? Actually, as a procedure, it's around 7,000 years old. But as practice, it's only 200 years old. Practice meaning practice knowledge and all the steps that you will see. So going into a bit of history of the Royal College of Surgeons, when did they start? The Royal College of Surgeons of Ireland, established in 1784, so it's almost 200 years. The Royal College of Surgeons of England, 1800, exactly 221 years. And the American College of Surgeons was established in 1913. So what are the levels of surgical education? So it starts with, of course, the Arabian Gulf University, where we all graduate from. And I am proud to be a graduate of the Arabian Gulf University. Then you go into your postgraduate programs. So either the Saudi board that my resident once upon a time has alluded to, and the Arab board as well. He has both certificates. Okay, that's great. And I'm a program director in both. And then, of course, you go to a fellowship or a subspecialty that you choose yourself. So, what should you do if you're really interested in surgery and you're in medical school? Get involved in surgical research. Involve yourself either in medical school or participate in the hospital based researches. And there are a lot of researchers these days, especially that everybody is keen to have a publication. So you'll see a lot of people working on research. Do approach a lot of people. I have one who is one of the distinguished speakers in this conference that approached me, and we worked together into researches. Right, Dr. Fatma Al-Faiz? Anyhow, then you come to your surgical rotation. Do attend on time. That's an advice to all. Read while you're doing your rotation. Show interest. Don't just show that you're showing yourself and you're attending and you're not reading anything. Attend the calls. Tag along. See somebody who's interested in teaching and tag yourself. That's what we did, all of us. Attend the emergency. Attend the surgical procedures that are done. Do go to conferences and workshops. And now that we have virtual conferences, it's very easy and it's maybe more cost effective. Volunteer to assist in these conferences and workshops. A lot of people want the medical students to help around, and this will enrich your CV. So you've graduated from medical school, which is soon, inshallah, for R6, which is, I think, by June, inshallah. So, what is surgical education now after you graduated? You need number one to create a foundation of surgical knowledge. So, reading is one. Not a technician is number one, reading. Then, master your clinical judgment in the management of surgical patients. So, you have to have a sound clinical judgment. Then, in the end, you develop your technical competency. As you go along, you as a resident are confronted with increasing complexity and take on graded responsibility from R1 to R5 accordingly. So, in our institute, what do we have? Which programs? We have the Arab Board of Health Specialization, which was established in 1971, and we as Salmania were accredited since then for the programs that started. The main one was general surgery. Saudi board was established in 1982, and Salmania was accredited for general surgery from 2006 and then re-accredited in 2013 until now. So the years that you spend, and everybody keeps on asking, how many years did you spend in your residency to reach where you have reached? So if you're interested in general surgery, it's a 5-year program. Urology again is a 5-year program. What about pediatric surgery? Pediatric surgery, plastic, and neurosurgery are all 6-year programs. Then again, you have to do your subspecialty. You finish general surgery. Either you want to do a 1 year general specialty or a 2 years of subspecialty or 3 years of super specialty. So you add and you do the math. I'm not doing that. So how is a surgeon in training week? Let's assume you are here already and you have a full week. What will be there? On Sunday, you may have rounds and clinic. You come to Monday, which is a typical day in surgery here. You do rounds, then you have your educational day, you have your lectures, your protected hours, and you may be on call, either morning call or evening call. Tuesday, yes, you may be post call, but do attend for your rounds on time. And you may have the operation theater. Wednesday again, rounds and clinic. Thursday, you again. So you have twice a week clinic and twice a week operative day. And of course, one day, which is the educational day. Then you have the weekend. How is it divided? You may be on call on a Friday or a Saturday, and there are mainly 2 weekends in a month. And we make sure that happens, being a program director and the coordinator. Then you may come and be assigned for weekend rounds. Show your interest, even when you are a resident. I've been attending everyday rounds since I was a junior. So, how did I start? So, my career started by graduating from medical school and proudly graduated from AGU. This is me receiving my graduating certificate. So, how many years did I use of my life? Okay, so spend in their surgical career. You do the math. Medical school, it was 6.5 years. Yeah, we started with 7 and then they removed 6 months, and now the program is 6 years. Yeah, we were the fortunate ones that became 6.5. Then I spent 1 year of internship at Salmania. During my time, there were 6 months of post internship. Some people did more than that until they get in a residency program. I entered the general surgery Arab board program because pediatric surgery was not yet a program in any of the specialties yet. Why did I write 6 years? Because 5 years of training, and the sixth year is when your exams are done. So you have your written exam, you have your clinical exam, which finishes in 6 years. Then you have 2 years of fellowship, but I did spend 2 years before going to my fellowship. After that, I got entered in a fellowship program at the Children's Hospital of Eastern Ontario and University of Ottawa, which I spent more than 2 years a bit. And then I came back for post internship. After all these years, I was appointed a consultant, and you do the math. So, who am I? The introduction said I'm the first and up to date, the only female consultant pediatric surgeon in the Kingdom of Bahrain. But there are a lot of females who are coming for training now, and they are maybe following my footsteps, and I'm training around 5 females so far. So, yes, all the hard work pays off. I got honored by the Order of National Action Award in 2018 from His Excellency King Hamad bin Isa Al Khalifa, the King of Kingdom of Bahrain. And this was in 2018. So, what do I do now? I'm a consultant pediatric surgeon. I'm the head of pediatric surgery unit. I'm a council member of Department of Surgery. I'm actually a clinical lecturer and soon to be hopefully an assistant professor. Pray for me, a training coordinator and program director of surgery, and the coordinator of the family practice residency program. I'm in charge of the continuous professional development in our department and a member in the mortality morbidity committee and the chief editor of Department of Surgery annual reports, and I'm proud of being all that. It takes time, but I love doing them. So, where did I work? Of course, my main place is Bahrain, but I did have a license where I worked in Canada. And then I did attachments where I did get a license to work in India in two consecutive centers, which are very well known. Okay, this is my pathway from internship, and I received my membership of Royal College of Surgeons. Then that is an additional certificate which I would advise people to go through, like what Dr. Abdullah Ismail did. And it's a very good thing if you want to do your postgraduate or fellowship that you have a GMC certified. Then I had my Arab board certificate, my clinical fellowship from Ottawa and Ottawa University, and I did on my own the short term training and left to do subspecialties. So what next? I've done my all my training. No, training continues. And since I started in surgery, I attended 33 courses until today, 38 workshops, conferences 70, not mentioning the virtual symposiums. I've been attending virtual symposiums not only in COVID 19, but since 2009 when they started. And I had attended 67 of them. The virtual meetings and conferences in 2020 with the COVID era, I attended 15, and only the ones that are for COVID, I attended 7. So these are my publications, which you have to all work on. They're not funny, but hopefully I'll work on them. You have to have membership in societies that are close to your specialty. I'm a member in the Bahrain Medical Society, my membership of the Royal College of Surgeons of Ireland. I'm a member in the International Society of Pediatric Oncology. International Pediatric Endosurgery Group, anything that's related to pediatric surgery and accounting. Of course, the Canadian Association of Pediatric Surgeons that I'm proud of being a member of. These are a bit of screenshots of the annual reports I've been working on and I published, which is the annual report of Department of Surgery 2010-2011. Then we did the 5-year 2012 to 2016, 2017, and the rest once they're published, I may share with you guys. Of course, you have to have volunteer work, as all my colleagues mentioned, and I do of course, volunteer examination and consultations and different societies. You never forget your mentors, and these are my mentors throughout my pediatric surgery career. The first one is Professor Hussam Hamdi, who was the dean of the college, and he was the head of the Department of Surgery in the Arabian Gulf University. Dr. Mohammed Amin Awadi, my mentor and always my mentor. And he is here with me and he taught me a lot. And my colleague, Dr. Nabil Ashiri, who is the Chief of Medical Staff at Salmania Medical Complex. This is the present day, and maybe you may recognize my team. And I'm proud to have a team with me and train them and teach them. So is this the end? Of course not. We will never reach an end. So it's actually a start of a new beginning. Take home message, never stop, caring, learning, and training. Follow your passion. It is not easy to be a surgeon, but never give up. So this is a Zoom lecture. Thank you for your attention. Could this be the new norm? Actually, it has been going on for the last 1 year. Inshallah, we will have something like 2 together, but let's have this era where we are a bit enjoying, at least we can share together what we have. Thank you very much for listening, and I hope I have added some information to what you know and added something to what you don't. Thank you all. I'll stop sharing now.
Thank you, Doctor, for this presentation. It was very
Thank
informative.
you.
We
Thank
have
you, Dr.
around
Haider.
3 minutes, Doctor, for questions. It was a very informative presentation, and you're a role model to all of us. Thank you so much.
Oh,
I just
thank
want-
you. Thank you.
Yeah, thank you so much.
So what do we have questions? Fatma Al-Faiz says, thank you, Dr. Fayza, proud to get the chance to work with you. Yes, she did. Okay, so I want to ask that now pediatric surgery is a board, not fellowship after GS board. Yes, actually pediatric surgery is a board, and having Arab board shifted, as Dr. Abdullah said, to tier 3, you still have to do a fellowship in a subspecialty in pediatric surgery. So you'll be doing pediatric surgery, but it's again divided the 6 years. 2 years, which is general specialties of general surgery, and then the 4 years would be the pediatric surgery related rotations. Thank you, Dr. Fayza. Thank you very much. Thank you all. Thank you to all the presenters. Everybody did a great job and presented very nicely. I hope I did justice to the presentation that was requested to me. Thank you.